Hello, this is Dr. Komnoshi. I'm GP at King's North Medical Practice. In this series, we're looking to common conditions that could be treated at home without the need to see the doctor. Sinusitis used to be a very easy GP consultation. Why? Because patients are normally correct with their self-diagnosis that they had sinusitis. They normally try with steam inhalation and paracetamol for about a week before they get fed up and come to see the doctor. Then they leave within a few minutes with a prescription for antibiotics for a week. They take the antibiotics, normally they don't get better, so they come back to the doctor and the doctor thinks, okay, let's give another week course of a stronger antibiotic, and the patient finishes the course. Now they are into about 3 weeks of their symptoms, and by the end of the second course, they normally get better. This was the scenario in the old days, but in the last few years, this practice was challenged by evidence. The science shows that antibiotics actually don't make much of a difference. So the NICE guidelines, the guidance that most doctors go by, suggested a different method. This is the sinusitis flowchart from the NICE guidance. It's a bit busy like this, so let's break it down. The first question, how long the patient had the symptoms. If it's less than 10 days, then the recommendation is no antibiotics, try decongestants like Vicks spray or nasal saline, paracetamol and ibuprofen. Symptoms normally get better on their own within about 3 weeks. If it happens, that's good news. If it doesn't happen, then the patient should see a doctor to consider alternative diagnosis, because the very nature of the sinusitis that it improves on its own, and of course see the doctor if there are signs of other serious illnesses. There is no direct recommendation that after 3 weeks the doctor should prescribe antibiotics, but this makes sense. After assessment for alternative diagnosis or a serious illness, what would a doctor do? Yeah, maybe try antibiotics after 3 weeks. Let's see what happens in the doctor's mind if the patient calls in with symptoms lasting longer than 10 days. The guidelines suggest nasal steroids for symptom control. Nasal steroids are also a type of steroid spray that the patient put it into their nose, and it's a strong anti-inflammatory to reduce the swelling, so the sinuses can open up and all the mucus can come out, and the sensation of fullness and tension that gives the awful headache will just reduce. Mind you, nasal steroids are available without prescription over the counter under the brand name of Baconase. It's important how we take the nasal sprays because if we don't use the correct technique, then it won't go to the right place and they won't work. I put a link to another video into the descriptions so you can see how to take the nasal steroids correctly. At this point, the guidelines still suggest no antibiotics, or maybe a backup antibiotic prescription if the symptoms are not resolving after 7 days, or if they rapidly worsen. So if we think that the symptoms are now more than 10 days when the patient present, so maybe let's say 11 days, plus the 7 days of the delay of the prescription, so we are coming down to the 3 weeks with the symptoms. So this side of the flow chart practically also suggests no antibiotics for 3 weeks. Why is that? Because we have now evidence that 98% of sinusitis are caused by viruses. Antibiotics won't work for viruses. It's only 2 in 100 are complicated with bacterial infection. Withholding the antibiotics It's unlikely to cause complications. So it means that if you don't take antibiotics, you're not really risking of getting worse. Antibiotics can have side effects, nausea, vomiting, diarrhea. You might not want these on top of your sinusitis. Of course, doctors will consider factors that might increase the risk for bacterial infection, like patients with reduced immune system. Also, it's important to control other inflammations in that area. For example, smokers have chronic inflammation in their airways, and hay fever also causes swelling in that area. So treating these are important to get you better sooner. The guidelines also suggest that we provide information to the patient. This is the link for written information from the NHS. I also put it into the description box. It's a little note about antibiotic choices. First, we prescribe penicillin if it's needed, or if there are signs of serious illness or complications, we give a combination antibiotics called coamoxiclav. If the patient is allergic to penicillin, we can choose between doxycycline and clarithromycin. So let's say that the patient tried it with the nasal steroids. We are down to 3 weeks. They're still no better. They start to take the antibiotics. So hopefully by the end of the course, the patient will get better. Now we are about 4 weeks of the symptoms starting. If the patient is still not better after finishing the antibiotics, then we really need to see them back to consider alternative diagnosis or serious illness. What serious illness are we talking about? Complications, as we discussed before, are quite rare with sinusitis with people who had normal immune system. However, it still can happen that a severe infection affects the eye with edema that you can see on the first picture, or cellulitis, which is inflammation, redness and swelling around the eye. Please note that is around one eye. It's very, very rare that sinusitis would cause complications in both eyes. If both eyes are affected, we need to consider alternative diagnosis. Displaced eyeball is very scary on the third picture. Actually, this picture is from a patient who didn't have sinusitis but who had sinus cancer. It is again very rare, but it might cause displaced eyeball, double vision, unable to move that eye, or blurry vision. If you have any of these, it's unlikely that you have sinusitis. You need to see the doctor urgently. Other complications that are not affecting the eye, it could be the swelling of the frontal bone that you can see on the fourth picture. The forehead is swollen. If there are any neurological signs of very severe frontal headache that is not the normal annoying pressure type headache from the sinusitis, then you need to see the doctor urgently. So this is the full flow chart again for your information. Practically it says no antibiotics for 3 weeks. After the 3 weeks, if you are still no better, consider alternative diagnosis or serious illness. If there are no signs of these, then try a course of antibiotics. Why no antibiotics in the first 3 weeks? Because 98% of the cases are viral and will resolve on their own. Nasal steroid, nasal decongestion or saline could help with the symptoms. Treating hay fever and stopping smoking also important. Complications are rare with patients with normal immune system. So I hope I helped to give you some insight how your doctors make the decision of your treatment for sinusitis. So we are not prescribing antibiotics, not because we are mean, not because we are difficult or want you to suffer for longer, simply because they do not work. And with or without antibiotics, if you have sinusitis, you need to be prepared to have symptoms for 3 weeks. I hope you will get better soon. Bye.